So I'm very happy, I'm more than happy to be here to actually present to you about the findings and recommendations of the work group on ADHD. In fact, much credit should be given to them because they put in many months of hard work and to bring to you this booklet. Okay, great. So just a follow-up to what Daniel has to say, because my bit is pretty dry, okay? How many of you actually sees more than 30 patients a day? Okay, or maybe you're too shy. I remember that when I was in polyclinic, I used to see about 60 patients. And you're multitasking, and then you must be wondering, well, actually sometimes I do have this kind of feeling too, because I sometimes feel that I might be ADHD, because I'm actually multitasking, all right? So ADHD does have its perks because it makes you really, do a lot of things at one time. But thankfully, we are not ADHD. We are just overworked, that's all. Okay? All right, so let me just proceed on to the slides that's been prepared. Okay, so I believe all of you have got this book sent to you last week or a couple of days back. So take your time to peruse it. But these are just some of the key things that I want to talk about on psychosocial treatment interventions for ADHD. Now, some treatment considerations. We need to look at the child factors, age, compliance, health as well. And I want to add on the child's temperament, okay? Yeah. So the child's age will influence what kind of treatment interventions that you might want to implement. Like, for example, a teenager with ADHD, you may not want to use too much of parenting skills. So parenting skills probably more suited for the younger children. And compliance. Children don't usually have a say in the medications, but teenagers do. So teenagers with ADHD may not be so agreeable to taking medications. And physical health. Sometimes our kids do have some physical conditions that prohibit them to take medications, for example. Yeah? And of course, child temperament. Okay. We also need to look into family and parents. What is their preference? I'm glad to say that most parents in Singapore are not so keen for medications. All right, I do have a few parents who are probably quite exasperated after years of trying to help the child. And we also need to know what is the support that the family has for the kid as well with ADHD, and what their skill set and what kind of knowledge they possess. Okay. The illness factors, like what Daniel has mentioned just now, is we look at the levels of impairment. If you're an A-star student, you're well liked by everybody, you're a teacher's pet, and you have lots of friends, so who cares whether you have ADHD, right? Because you're doing so well. So ADHD, in order to be a disorder, you need to confer a level of impairment in the function. So social, academic, and occupational. So for children, it's mainly academic and social. So if you're doing well in other areas, in these areas, and when you think that if someone comes to you and say they have ADHD, then you're going to have a little bit of a higher index of suspicion. Okay, and sometimes other psychiatric or psychological conditions can mimic symptoms of ADHD, like what's listed here, anxiety, oppositional defiant disorder, conduct disorder. And sometimes the interaction is not very clear. So it's a chicken and egg. So is it ADHD or conduct disorder, or is it conduct disorder mimicking as ADHD disruptive behavior? Okay, so we all know that ADHD, there's a high propensity for them to have learning problems and mood anxiety, as well as behavioral problems. So we also want to rule them out too, okay? All right, and treat that primary condition in its own right. Now, education certainly plays an important part. Psychoeducation, all right, is to actually inform the child, the teenager, and the family, parents, about how do we come to a diagnosis, what are the treatment options, what is the natural cause of the disorder, okay? It facilitates symptom recognition, active participation in treatment, enhance adherence to treatment, and to provide patients and families with coping skills. In fact, medication non-compliance is very high. I know in our midst we have several GPs, and I think this you probably understand. You always tell your patients, you better finish your course of antibiotics, right? And a lot of times they don't finish that. And I suppose as doctors, we know we are the worst patients ourselves. We don't often follow through with our medication treatment as well. So if you can spend time to actually psychoeducate them, you can actually get them on your side and be your co-therapists in a sense, and understand why intervention is so important. And you also need to give developmental appropriate information as well. Okay, so after diagnosis, doctors should provide appropriate education about ADHD to children, families, and if you can, teachers as well. Because teachers are partners in this as well. And I think there are some counselors and teachers from school here. That's really great. So the level of evidence is plus B1 and grade B. So the book itself has a list of the level of evidence as well as the recommendation grade. Okay? So B is not bad, and level 1 is really good. Okay, now the focus is on psychosocial treatment. So it's not so much pure psychological treatment, which when you talk about psychological treatment, talking about cognitive therapy, behavioral therapy, psychological interventions. So this is actually a combination of some psychological aspects together with social interventions, family, social skills, behavioral interventions. So sometimes this term is used interchangeably with behavioral interventions. And it is, in fact, the recommended first-line treatment for the very young. In fact, for all, I recommend it's actually I tend to say that it's actually for all kids with ADHD, especially so for the young ones and the preschoolers. And it can be used in combination with medication. And you cannot do alone with just treating from where you're sitting in the clinic. You need to really work with parents and schools. So they are like your co-therapists. Whatever they teach, you ask them to replicate that in the home environment and in the classroom environment as well. Okay? Right, so these are also it can be complementary to the alternative options incorporated in the CPG as well. Behavioral interventions are aimed at modifying antecedents and or consequences in order to change behavior. So you need to, when an incident happen, you need to tease it down to what are the factors leading to that behavior, what maintains the behavior, what was the behavior about, and what are the consequences, what are the sequelae after that. So you need to consider giving effective instructions, commands. Sometimes you do have a need to use a token or point system, like a carrot and stick system. You need to constantly use positive reinforcement. You want to encourage the child to continuously produce a set of desirable behaviors through your acknowledgement of his efforts, rewards, giving up of privileges, and so on and so forth. And if the child is not doing so well, and you want to punish him for something he has done, you may want to institute a natural consequence. All right. In the old days, natural consequence means you take out a cane stick. All right. Now, no more. It can be seen as being abusive. So we usually give a timeout. All right. Or you may want to withhold privileges. Okay. Or you might want to ask them to do a chore they don't want to do. All right. Like housework. Okay. Now, skills training is also very important. A lot of our kids with ADHD do have some social skills deficit. They are generally quite impulsive, so they'll act before they think. So they often offend a lot of kids, a lot of friends and classmates. So we need to teach them how to make friends, how to maintain friendship, and how to take turns, and so on. Okay, and these behavioral interventions should be taught to all parents with ADHD children, as well as school personnel. Now, we do sometimes go on to intensive behavioral treatment, all right? And these are being, elucidated in more recent trials. Some trials specifically look at parenting training, okay? Some look at school-based intervention, which Dr. Mariam, later on, the speaker after tea break, will talk about. And some are just very intensive summer camps, all right? In Singapore, summer camp is throughout the whole year, right? There's no summer. Summer is throughout the whole year. Okay, yeah? So, not boot camp, all right? Boot camp always have this bad connotation to it, yeah? So school-based treatment includes teacher consultation, classroom behavior management, and strategies. All right, so the school counselors, school allied educators, special needs officers, as well as the community mental health team that Daniel talked about just now, they actually work collaboratively, and they can actually add value to the school teams. The teacher aid, and of course, daily report card. For the child summer treatment program that overseas focus on, they look at point system, reinforcement, timeout, social skills, sports, non-academic activities, problem-solving skills. Okay, so behavioral intervention is consistently rated as evidence-based treatment is in systematic reviews and major CPGs since 1990s. Hence, doctors should consider educating parents of children with ADHD and behavioral management about behavioral management strategies, or to refer them to professionals who can do so. And it's been given a very high grade of recommendation of A, with level of evidence of 1++, okay? Like a net plus. All right, so high value stuff here. Let's talk a little bit about parent training, because parent training is really, probably one of the key factors of psychosocial interventions. Sometimes the saying, like father, like child, like parents, like child, children model after their parents as well. And if we are not effective parents, then we find that the kids get away with certain set of behaviors that we do not want. Studies have shown that parents have actually increased parenting stress. I have a lot of parents who come to the clinic because they're so exasperated, they're very stressed, they're being hounded by schools, by tutors, and they really do not know how to manage their kids, all right? They are literally tearing their hair out. So they're actually at the high level of caregiver stress there, okay? And they sometimes have maladaptive parenting strategies which maintain difficult behavior. Take, for example, a very simple example is if you give in to a child's demands, you then tend to perpetuate that throwing a temper tantrum is okay. All right, you get what you want at the end of the day. Yeah? You always win at the tug of war. And a lot of our parents are very busy. They delegate a lot of parenting jobs to their domestic helpers or the school teachers. And sometimes they can't do the parenting skills consistently. That is also one problem too. Okay? And when parents are very stressed, they can become quite punitive because they're so angry. All right? And sometimes may lead to abuse. So there are actually, in existence, manualized parent training interventions that Singapore uses, and many of these programs are adopted from overseas. Like, for example, Triple P, Positive Parenting Program from Australia, the Incredible Years, we have the Parent-Child Interaction Therapy, and the New Forest Parenting Program. The New Forest is probably very new because I don't know what is it. Okay? And of course, for the developmental piece, and they also have signposts and lots of other kind of parenting programs. And my department is actually exploring web-based parenting program because parents, you ask them to learn parenting skills by coming to the clinic or listen to talks. They don't want to do it, but they don't mind watching a DVD on it. So maybe we can actually incorporate web-based parenting skills training on using that method. So parent training is rated as evidence-based intervention by systematic reviews and major CPGs. Few studies involving adolescents evaluated to be cost-effective, and the positive effects can persist for up to 5 years. However, you must put in some considerations there because we are not Westerners, so there are some cultural considerations, okay, as most of these programs were developed in the Western countries. Okay, and of course, you must think about the child's own mental state, the cognitive development, How old is the child? Is the child a preschooler? Is the child school-going? Is the child an adolescent? And so on and so forth. A meta-analysis of 8 studies in preschoolers showed a standardized mean difference of minus 0.77, which is moderate effect size. Concluded that parent training had strength of evidence, and methylphenidate, which is the generic name, the brand name would be Ritalin, right, or Concerta, right, which these are only 2 stimulants available in Singapore, had low strength of evidence. Parent training should be offered for parents of preschool children with ADHD, grade B, level 1+. The Cochrane review of studies, Cochrane is like the mothership, all right, which is really a very robust way of reviewing research papers. They are like the authority, involving youth between 5 to 18, and the quality of studies are questioned due to lack of blinding. Sometimes, it's very hard to blind a parent training. As the word implies, parent training means to train the parents on how to do the child's behavior. So it's very hard to blind the subjects, the research subjects or participants. But nevertheless, doctors should consider referring parents of children and adolescents with ADHD for parent training programs offered within the community, particularly where negative parenting practices were identified. How about social skills training? Whenever we teach training of skills, we hope that skills can be brought from the clinic to the schools and to the homes, that it can be generalized, okay? So part of what social skills training encompasses would be problem solving, emotion regulation and control, as well as verbal and non-verbal communication. So there were 11 randomized trials from the Cochrane review involving children up to age 12, a duration of 8 to 10 weeks on social skills training, up to 2 years. Unfortunately, there's not much statistically significant treatment effects on social skills and ADHD symptoms. But nevertheless, parents still find it more acceptable than medication. So, if you feel that the child does have some social skills deficit, it is still very acceptable to use this form of training. Although reviews show lack of efficacy, it is often included as a component of intensive behavior treatment program. So social skill training alone is not recommended for management of ADHD, but an adjunct to parent training and a multitude of other forms of interventions, including medications. Now, cognitive behavioral therapy, CBT. CBT is psychotherapy, or in the layman's term, talk therapy. And this is some of the very basic fundamental psychological intervention widely used, practiced in our clinics, okay, over the world. Mainly, it promotes self-controlled behavior through identifying your thoughts, your feelings, and coming up with a set of behavior that helps to make you feel better. All right? Yeah? For example, if your friend this is what I encounter in my pediatric population. If the teenager or child don't get a text back from the friend, they will have a lot of negative thinking. My friend don't like me, they hate me, so they are not answering my call or they're not returning texts. So that is the negative automatic thinking. That can bring about a lot of different very unpleasant feelings of anxiety or sadness. And then the behavior could be they get upset, they get angry, they may cry, or they throw a temper tantrum. Most often of the time, when your friend don't answer back your text, it's because their battery ran flat or is in silent mode, right? Okay? So if we can teach them how to identify those thoughts, they might feel better. Well, it's not my fault. I think that something may be happening, all right? So they don't have a negative attribution to what has happened. So in CBT, there will be verbal self-instructions. They'll be taught how to do more adaptive, healthier self-instructions. There'll be problem-solving skills, cognitive modeling, reconstruction of your thoughts, self-monitoring of your feelings and your thoughts, self-evaluation, and self-reinforcement. Okay? Okay. So, however, for ADHD, reviews show no evidence for CBT, and no evidence at present that psychological treatment are more efficacious for older children. All right? So, kids sometimes, when they have very poor working memory, just now as Dr. Fang has mentioned, weak working memory, problematic processing speed, cognitive therapy may not be the best for them because they're not able to focus, process information. How about diet? And it has been quite inconclusive, actually. All right, you know, well, a lot of time there are a lot of myths and misconceptions about food. So the meta-analysis showed that there are a lot of risk of bias in studies about diet contribution to ADHD behavior. You know, and there's no evidence of sugar being, precipitating hyperactive behavior. But having said that, there's a small subset of patients who may benefit from a low sugar intake, all right? Especially if the parents are able to observe a very pronounced change of behavior after a sugar-laden drink or food. So this may happen in probably 10% of kids, right, who may be more vulnerable or susceptible to the effect of sugar. So there's no clear evidence for food additives and sugars to be related to ADHD. Parents and children should be advised to control food items containing additives or high sugar content that have been observed to consistently provoke physical or behavioral reactions. How about restricted elimination diet? Okay. So sometimes to the extreme end of diet controlling sugar, some may read about it over the internet that what kind of diet, gluten-free diet is good, and so on and so forth. I think the jury is still out there, and we're not entirely very sure. And it's definitely not recommended for the management of ADHD at this moment. Because there are a lot of other risks involved, like nutritional deficiency, and it's very hard to implement. In a food haven or heaven like Paradise Singapore, how do you think you can prevent someone eating your char kway teow or laksa or your favorite chicken rice, right? It's really problematic. How about omega-3 fatty acid supplementation? So I'm quite sure you're acquainted with the main omega-3 fatty acids. Okay, so there is some hypothesis that there's a deficiency of the omega-3 fatty acids in the brain and causing alteration of biophysical properties of cell membranes. Okay, so AA and DHA may modulate gene expression and also protect, DHA specifically, may protect the brain from free radical damage. So there's still no conclusive evidence, but however, it is certainly something that's more acceptable by parents if they want to consider any form of supplements. So they may not be very keen for stimulant medication, but they may ask you for advice about supplements, and this is something that we share with them, and it's totally up to them whether they want to consider omega-3 fatty acids as a supplement, especially if the child has a very poor and unbalanced diet intake. So there's a lot of heterogeneity among studies with variable dose and ratios, plus minus vitamin E is included, but you have a small effect size of 0.31. Okay, and for the other the reasons listed there, omega-3 supplementation may be used as an adjunctive treatment for ADHD. How about Zing? Okay, I know Zing is good for skin, but there is some mention about Zing may be helpful for kids with ADHD. All right. So small studies have shown possible mineral deficiencies in certain groups of kids with ADHD symptoms. So the questions about generalizability of findings as studies may have been conducted in regions with endemic deficiency. And overall, there's no evidence to support use for all children with ADHD. So if your kids are having a balanced, highly nutritious diet, then there's less fear for your kids to suffer from this deficiency as the reason for ADHD behavior. Neurofeedback. So there has been a lot of advances in neuroimaging, and results are very encouraging. In some of the neurophysiological studies, so some children with ADHD have somewhat different EEG patterns, brainwave patterns. Okay? Neurofeedback therapy or neurotherapy trains the individual to alter or normalize EEG rhythm. Okay? So you teach the brain how to hold on to those brain waves that you want to achieve. So they help us. In fact, in our clinic, we do have some a study going on that. And there are also at various centers doing the studies as well. So when you play a game, you need to focus. The brain wave registers that brand of brain waves. So if you don't focus, the brain wave is out of sync with that one desired brain wave, the game can't proceed. So we're using a game to actually engage the child, and we teach them how to achieve the same brain wave that denotes focusing and concentration. Then the game can proceed with it. So it's part of training, yeah? Teaching the brain to reconfigure the brain waves. So the review meta-analysis showed medium effect size of 0.69, which is pretty good. Okay. However, there are, again, some methodological concerns like lack of blinding and lack of long-term data. So neurofeedback should not be used alone for the treatment of ADHD, hence being awarded a grade of B. Cognitive remediation consists of working memory performance intervention in this area. As you know, working memory often is impaired in kids with ADHD. So computer-based training may improve working memories as well as help to generalize the memory to do other forms of tasks. Reviews of studies, however, did not show improvement in ADHD symptoms or function. So cognitive remediation alone is not recommended for the treatment of ADHD with significant impairment. All right? How about sensory integration? All right, this seems to border onto occupational therapy's realm. Some children with ADHD may have sensory processing difficulties or motor skills difficulties. And you must have heard about central auditory processing disorder or auditory processing disorder dysfunction. So these are sensory processing disorders, but unfortunately they are not medically recognized, and still highly controversial in the medical profession. So review concluded limited evidence on sensory-based therapies. So a referral to an OT may be required for children with sensory problems or motor skill deficits. Now, TCM and acupuncture. I'm glad that this is also being reviewed. In fact, I've just completed a study of TCM use in ADHD children, all right, and was currently studying the results. As you know, TCM incorporates different forms of herbal preparations. You go from one TCM clinic to another, the preparation for the TCM to treat ADHD may differ widely as well. The medication I studied consists of 7 components of herbs and I was about to say spices, but I'm not talking about cooking. Herbs and roots, okay? All right, yeah? So that's because tea break is after this, huh? All right, so the review suggested high likelihood of publication bias because most of these studies are published in China. And for one, we can't read Chinese words very well. All right, and a lot of bias, heterogeneity among TCM preparations, like I said, and the quality of the trials is also at some point questionable. All right. Acupuncture itself suggests there's no quality trial. But every now and then, the parents of my kids with ADHD do bring them for TCM or acupuncture. But this is their own subjective assessment. They feel that it has helped. So do be mindful of the evidence against what is being actually observed. So at present, there's still no evidence to recommend their use. But no one is stopping them if they want to go on with it. Care transition. All right, so remember that ADHD is a lifelong condition. So 60 to 80% of kids with ADHD actually go on to still have ADHD symptoms as a young adult. It's just that they are better able to manage the symptoms, and the ADHD symptoms may evolve. So they're not so hyperactive anymore, but they can still be inattentive and impulsive. So transition to adult service for those with continuing needs is really important. And in IMH, there's also a team of adult psychiatrists who are very keen to actually work with adults with ADHD as well. So clinicians who treat adolescents with ADHD should plan for the transition to adult health services in advance. Discuss this with the patients and their families to ensure that they can continue to receive care. Long-term studies of ADHD individuals show that they actually have a higher risk of police records, road traffic accidents, other health-related problems, and substance abuse. So we must be mindful that ADHD doesn't stop just after you go on into adulthood. Thank you.